My name is Michael. I live with Robert and I live Pauline in with home, ported out in Salford. People with learning disability die up to 38 June. They and later population.
We both have learning disabilities. I have had our health check done at the GP, and often from things that could have been prevented, like sepsis and dementia and pneumonia. By treating people and their families with dignity, general practice in Salford will gain the respect of people with learning disabilities and save lives.
We know from the LEDA annual report that people with learning disabilities are dying from a range of health inequalities. People with a learning disability might experience communication difficulties, and this can limit their ability to express pain, discomfort, or just generally communicate that they feel unwell. The 2020 LEDA report found that 42% of deaths of people with a learning disability were found to be premature. The health checks can identify undetected health conditions early. They can ensure appropriateness of ongoing treatments. They can establish trust with the learning disabled person, and they can also support continuity of care. The templates have now been uploaded onto GP systems in Salford.
Supporting people with learning disabilities has been chosen as a quality improvement area identified for general practice because of the need to improve the care of this vulnerable population. We've created a new electronic template to support the proper completion of the annual learning disability health check, which was made in consultation with GPs, practice nurses and clinicians in both adult and children's general and specialist services. So what do practices need to do? They have to improve the accuracy of the GP learning disabilities register that they hold. They have to increase uptake of annual health checks, including a personalised health action plan. We need to perform medication reviews with a focus on the appropriate prescribing of antipsychotics. We need to record the need for any reasonable adjustments required and flag this on our systems. We also need to consider the wider use of community support with local LD services and social prescribers.
If the patient has already had a health check, maybe this has been completed by the special school nurse, there isn't a need to do the whole health check again. Just complete the parts that haven't been done, maybe the mental health check or the medication review. Using our learning disability health check template will help to achieve standardisation across Salford practices. It will improve the quality of the overall health check experience for a person with a learning disability, and it will lead to improved health outcomes for people with learning disabilities in Salford. If you need any help or support with the health check, please get in touch and I will try my very best to help.